32-year-old Sarah Geldman is eagerly looking forward to marrying her fiancé Russell. Like most brides, she wants to look stunning on her big day. Sarah is considering liposuction to help her fit into the wedding dress of her dreams. Today, Sarah carries 135 pounds on her 5'6" frame, but it wasn't always this way. For most of her life, Sarah struggled with a weight problem.
I grew up more quickly than any of my peers. I was the tallest girl in my class until I was a teenager.
By the end of high school, Sarah had become obsessed with her weight, and she developed a serious eating disorder. Sarah was painfully aware of her destructive patterns. She was unable to make a change until, at the age of 29, she embarked on a hiking trip to Nepal. It's been nearly 2 years, and Sarah's new patterns consist of exercising regularly and eating balanced meals.
I'm happy with the weight I'm at, but the fat that's stored on my hips is a problem. And although I've targeted those areas in my workouts, I still have excess fat there.
With the wedding fast approaching, Sarah consults with Santa Monica plastic surgeon Dr. Stephen Varkony.
Hello, I'm Dr. Varkony. Nice to meet you.
Nice to meet you.
So show me exactly what you're interested in having liposuction. When Sarah came to see me, she was a typical patient who was not really overweight, but had some stubborn areas that she couldn't get rid of. We can take off the outer thigh, what we call the saddlebag area. And generally what I like to do is when I take this off, I like to just take off part of the butt here.
Good,
because otherwise you end up looking like you have a square butt.
I see liposuction as the last step in my effort to get my body to a point where I'm happy. And although this isn't a license to go stick my head in a tub of ice cream for the rest of my days, I think it's the last step in my struggle.
Sit down here.
Dr. Varkony marks Sarah for the procedure.
Okay, I think we're done. I think the next step, we'll just take you into the operating room.
Oh, right. I'll see you in recovery.
Yeah.
On the operating table, Sarah is prepped for anesthesia.
I'll dream about my wedding dress.
Okay. Okay, good. Once we have the patient positioned the way we want the patient to be, we inject this fluid, which contains some local anesthetic and what we call a vasoconstrictor to shrink the blood vessels. And after waiting a few minutes for the shrinking of the blood vessels to take place under the skin, we then start liposuctioning, and we use bigger cannulas at first, and then we feather or blend into the surrounding normal tissue by using smaller and smaller cannulas. And you can see that a lot of what's coming out here is pretty yellow. But again, it depends on the patient. Most of the time, there's very little blood loss. She had quite a thickness of pinch here before, even before we put the fluid in. And now you can see, look how thin the pinch is here.
Even though liposuction seems a relatively simple procedure to perform, it can be a very difficult procedure to do well. The surgeon can measure the amount of fluid and fat that is being removed from one side of the body or the other, but no one is symmetrical. During a liposuction case like Sarah Geldman's, progress is really judged by sight, feel, and comparison. That's something that comes with experience, and it's what the artistry of plastic surgery is all about.
Here, too, the fat is very yellow and very fluid.
After 3 hours, close to 4 liters of fat and fluid has been removed from Sarah's body.
We did the back of her waist, the back of her hips, the outer thigh. We sculpted the outer buttocks. We did the inner knees. We did the upper and lower abdomen. And you can already see that she's very sculpted, and she's going to look really wonderful for her wedding.
2 months after liposuction, Sarah is shopping with her mom for the perfect wedding dress to fit her new body.
I've always wanted a 30s style, form-fitting wedding dress. And before my surgery, I just didn't think that I could pull it off. And now I'm psyched to go try them on because I think they're going to look good and I think I'm going to feel great in them. My results exceeded my expectations. My saddlebag area looks good. I'm really blown away with my torso and my lower back. And my knees are outstanding.
Whoa, Sarah, it fits you perfectly.
I can see my thighs like I never have, and I can see my lower back, and I have shape in areas of my body where I worked so hard for years trying to get rid of, and I couldn't.
With newfound confidence, it takes Sarah little time to select the dress of her dreams.
It is so flattering on your figure. I can't even tell you. I mean, it's just perfect proportionally.
Yeah.
It is.
I think this is it. Like, I'm done. This is it.